So now let's take a look at what a disc issue actually is. So you could see in this drawing, I drew the disc. It kind of looks like a peanut. It's biconcave, meaning that the center part arches in from the top and the bottom. And I made this fancy prop for the demonstration. So what happens is, when you open your jaw, it doesn't just go straight back, or that would look really weird if your jaw just dropped all the way back like that. So as it opens, it also slides forward, and then it slides back. So it opens and slides forward and slides back. And what happens is there's a disc. The disc sits right there in the joint. And so as you open and it kind of slides forward, the disc moves like that. So the skinny concave part, biconcave part, always stays above this part of the mandible of the jaw. And what happens is sometimes, you may have heard of anterior displacement. What happens is this disc may shift forward and it gets stuck there. So someone's mouth can actually get stuck open or closed depending on how it gets wedged. Or as you open it, it gets stuck forward, it clicks, and then when you close it, it clicks back into place. It could be, and it could go medial, lateral, all different directions. But basically, a disc issue is when the disc is not in the proper place. And if that happens, and you can't open your mouth all the way as a result, that's when all of those muscle issues add on top of it, as we discussed before. And another thing that can happen is the capsule can get tight. So the capsule, I drew an arrow from there because it covers the joint. A capsule is basically ligament structure that holds two bones together. So where this bone and this bone meet each other, there's ligaments. Oh, I forgot, I have a little prop for that too. This little yellow band. So that goes right over the top here, like that, and it holds it together. Now, it's supposed to be loose enough to allow you to move. But if it gets really, really tight and holds on tight, there's restriction as you're trying to move through, and it makes it difficult to open your mouth. And again, that can contribute to additional spasms here.